Atypical hyperplasia in breast tissue. Usually, a patient with atypical hyperplasia will not present with any specific symptoms, although it can cause changes to be seen on a mammogram. The case that I looked into, the patient had a normal breast exam without a mass, nipple discharge, or skin retraction. Prior to having a mammogram, the patient must fill out paperwork including their history, their family history, previous and current medical conditions. In my case study, the patient had a history of atypical ductal hyperplasia that was discovered in years previous but was not of great concern. How is a diagnosis made? Usually, a diagnosis is made from a biopsy after an abnormality is found on a mammogram. MRI-guided core biopsies are a great tool to diagnose atypical hyperplasia and also determine malignancy or a cancerous mass. Below I have provided two images. One is a CC view of the mammogram, and one is an axial MRI image that shows the biopsy needle going into the mass. Sometimes atypical hyperplasia can be found when investigating a different condition. Ultrasound can also be used to see abnormalities found on a mammogram in some cases. The patient in my case study was unable to be referred for an ultrasound because the mass was not able to be seen on the MLO view. MRI is also a good tool when diagnosing and also for follow-ups that need to be done. The patient in my study had the MRI-guided biopsy. This was a great tool in helping diagnose the patient. Hyperplasia, according to the American Cancer Society, is an overgrowth of the cells that line the ducts or the milk glands inside the breast. Atypical hyperplasia is different from hyperplasia in that the cells start to stack on one another, causing an abnormal appearance. The cells look more distorted, unlike in hyperplasia where they look close to normal. Hyperplasia can be an initial stage in the development of cancer. Although not all patients with atypical hyperplasia will develop cancer, they are at a higher risk. What are the causes and other known names for atypical hyperplasia? The causes for atypical hyperplasia are unknown, but they may also be referred to as hyperplasia with atypia. This could be because the cells become abnormal or atypical, and the appearance of the cells is what helps determine what kind of atypical hyperplasia it is. There are two kinds of atypical hyperplasia. Atypical ductal hyperplasia, in which the cells make an appearance similar to the cells of the ducts of the breast. Atypical lobular hyperplasia, which the cells make the appearance similar to the cells of breast lobules. The statistics of atypical hyperplasia. Atypical hyperplasia is found on 5 to 20% of mammograms. According to the American Cancer Society, having atypical hyperplasia increases your risk of having breast cancer 4 to 5 times. According to Mayo Clinic, research has revealed that after diagnosis with atypical hyperplasia, risk of cancer increases in the following years. After 5 years of diagnosis with atypical hyperplasia, 7% of women develop breast cancer. After 10 years, 13% of those women develop breast cancer. And after 25 years, 30% of women develop breast cancer. If atypical hyperplasia is suspected on a mammogram, they will do a needle biopsy to confirm. Usually, atypical hyperplasia is treated with surgery, where they will go in and remove the mass. The particular study that I have been looking into, the lady had to have a surgical excision. The MRI-guided core biopsy that I had referred to earlier revealed infiltrating ductal carcinoma of the breast, where they went in and removed that and anything around it that could or looked like it could be cancer. Follow-up mammograms are very important. The American College of Radiology suggests that women starting at the age of 40 should get an annual mammogram. The American Cancer Society recommends a patient with atypical hyperplasia should see a physician more often, like 6 to 12 months, along with the yearly mammogram. The earlier that a cancer can be detected, the better. Follow-ups are very important, and sometimes patients with atypical hyperplasia will also have to have an MRI along with their mammogram for better diagnostic imaging. In this PowerPoint, I referenced Mayo Clinic, American Cancer Society, American College of Radiology, and Ralph Pickard, who was on MedPix for his case study of the MRI-guided core biopsy.